This year at EBMT, I am presenting a retrospective study of the EBMT Lymphoma Working Party on Idelalisib, previously to allogeneic stem cell transplantation for follicular lymphoma patients. Allogeneic stem cell transplantation is a feasible method for long-term remission in patients with follicular lymphoma who relapse or are refractory. And Idelalisib is an approved drug for relapsed or refractory follicular lymphoma. Therefore, it is also very often used nowadays for bridging patients to allo. However, information on safety or feasibility of allogeneic stem cell transplantation in follicular lymphoma after exposure to Idelalisib is limited. Therefore, the objective of this study was to assess safety and efficacy of allogeneic stem cell transplantation in follicular lymphoma after previous exposure of Idelalisib. Primary endpoint of the study was non-relapse mortality, and secondary endpoints were GVHD, incidence of relapse, engraftment, and survival. Eligible were patients with a diagnosis of follicular lymphoma and a previously documented exposure to Idelalisib. And altogether, we could identify 51 patients in our database fulfilling the inclusion criteria. However, we had to exclude 13 patients because of missing follow-up or unclear starting date of Idelalisib or missing information on clear Idelalisib exposure. That gave us 38 patients for analysis, and out of these, 25 patients received Idelalisib directly in front of allogeneic stem cell transplantation, so for bridging. Median follow-up of these 25 patients was 12 months, and non-relapse mortality in these patients at 12 months was 24%, and this was completely in line with previously published data on allogeneic stem cell transplantation in follicular lymphoma. Importantly, at time of transplant, 20% of the patients had a complete response, and at least 3/4 of the patients had a controlled disease at time of transplant. Incidence of relapse was relatively low with only 8%, and progression-free survival at 12 months was 70%, and 16 patients were still in complete remission at time of last follow-up, and this gave us 3 times more patients in complete remission after allogeneic stem cell transplantation compared to the time point of the transplant. So summarizing the main findings of the study, allogeneic stem cell transplantation after exposure to Idelalisib is safe, and Idelalisib is an efficient drug for bridging patients to allo. The survival data is completely in line with previously published data on allogeneic stem cell transplantation in follicular lymphoma without prior exposure to Idelalisib. And importantly, Idelalisib is very efficient and could provide high remission rates at transplant, but in addition also convert the allogeneic stem cell transplantation could convert additional patients into complete remission after transplant.